Welcome to our session for ST3 General Surgery Interview Tips and Tricks for this year. Just to start with, this is a recorded session. You will be able to see it later on our YouTube channel. So tonight we have two presenters, Mr. Mohammed Abul Azaim, an ST3 General Surgery in London, and Mr. Nazar Isa, ST3 in Vascular Surgery at KSS. They both were fortunate to obtain a number last year. They both worked really hard, and they are telling us today how they managed to get a number and what we can do to be successful this year. So, ground rules. If you have any questions, please put them in the chat box. We will collect them and answer them at the end of the session. And you will have an option to ask questions at the end of the session as well. Is someone already putting their hands up? Is there anything we can answer before we start, or is that a mistake? Okay, hands down. All right, so Mr. Mohammed Abul Azaim and Mr. Nazar Isa, the floor is yours.
Thank you so much, Yasmin. Thank you for the Egyptian Surgical Society for having us today. Hello, everyone, and I wish you all the best in your interview preparation. And as Yasmin said, the aim from this webinar is to go through some tips about how to prepare for this interview. And mainly, we are here to tell you about our experience from last year and the things which we did right and the things which we did wrong, so you can avoid them and manage them properly. Actually, there is no like one right way to prepare for this interview. There are many ways. At least we will tell you today about the way we did it. So I think any one of you think about what is the difference and what is the advantage of this virtual interview. And when we compare it with the face-to-face interview, the most important advantages of this virtual interview and online interview is that you will do it at your comfort zone. You are at home, at your room, and on your time, and everything under your control. So this is the best thing you have to do this virtual interview. Cost effective, yes, because there is no stress of booking hotel or to plan trip to other city to attend the face-to-face interview. Less number of stations. As you know, the stations before, there used to be 7 stations, if I'm right. So in this online and virtual interview, there are just only 3. And here I would like to remind my colleague who will attend the online interview for the vascular surgery. There will be 4 stations. They add communication stations beside the clinical scenario, management scenario, and portfolio station for general surgery. Regarding the disadvantages of this virtual interview, of course, on the top will be the technicality. So you need to be familiar with the Microsoft Teams app. And my advice here to everyone to use the Microsoft during your practice, daily practice with your colleague, to be familiar with the setup of this application. And the other issue is to be familiar also with the camera and how to set it. And we will speak about this later on. One of the disadvantages of the online interview is that there is no time between the stations. So you have reading time, and I will explain this in the next slide, but between the clinical scenario and the management scenario and the portfolio, there is no gap. They will not give you like few minutes to rest or to think about the next station. They will take you immediately to the next station. So once you finish the clinical scenario, the interviewer will say, okay, let's speak now about the management scenario, how you are going to manage this situation. And the disadvantage here is that there is no time to recover from bad station. As you know, sometimes you need few minutes just to think and to try to forget the previous station and to concentrate and focus on the next one. Maybe this is one of the things you need to practice and train yourself to recover quickly and instantly from any bad interview station. And that's why I will advise you during your practice with your colleague, you should practice the same way of the online interview, to have two scenarios in front of you. You will answer the first scenario, which is the clinical, and immediately will go to the management scenario. The last thing I think one of the disadvantages as well is that the interviewer will sit together in one room, and there will be a camera in front of them. So the one who is going to ask you about the management scenario will observe and attend your performance on the clinical scenario. But I want to reassure you that the interviewer are consultants, and they are fully trained. So unlikely there will be any bias, or the examiner or interviewer might have an impression from your performance on the previous session. So he will that will affect your score and his impression about you on the next session. I think that's nobody from my colleague reports that or had any concern about that issue. But this is something to put on your mind. In this slide, you can see very clearly that the competition ratio is very, very high. So when you compare it with 2017, it's 1.5. So the total number around 350, and those who got the training number was 236. But our year, if you see here, the competition ratio became 4.5, and the out of maybe around 600, only 136 they got the training number. So the message from this slide is that you need to work hard. This is not, although it's named as the interview, but it is exam-like situation. So you need to prepare for it at the exam rather than a simple job interview. So this is the just quick overview about the interview. And again, I remind everyone that we are speaking here about general surgery. So the interview time is 35 minutes. So 5 minutes will be reading time, and 10 minutes will be for clinical scenario. You will answer the clinical scenario in 10 minutes, and then the management scenario in 10 minutes, and then you have 10 minutes to speak and answer questions about your portfolio. As far as I'm aware, all of you now, you are awaiting the verification of your score. So soon you will get email with the final score, and then the shortlisting for the interview will start. And then you will start to get emails. I hope this year it will be like early, because last time we received the links for the interview maybe before 1 week or 10 days. And so what is the message I want to say here is that you start prepare for this interview from now, and don't await that invitation to the interview. The skills you are practicing and you are learning definitely will need it in your career. So it will not make any difference to you if you become successful or not in being shortlisted for this interview. So start preparing from now. I hope they will get you the send you the interview shortlisting before like you got enough time to prepare. But please prepare yourself from now. So once you got this link, you will go into different slots available on different dates, and then you will select your slots. On the day of interview, you will get the administrator. When you press on the link and you join the link, and they will advise you to join 5 minutes before your slot time. And then you will see the administrator. Sometimes you just say, you will see black screen, but someone is speaking to you from there, that he can see you and he can hear you as well, and he will introduce himself. And then this man or this lady, what she or he will do is to do the ID check. So it will ask for ID check. So I think the day of interview will be a very stressful day, but make checklist, make everything ready beside you, so you have your passport, any passport. But if there is no passport, they'll accept the UK photo driving license. And then after the ID check, the administrator will ask you to move the camera around your room just to check that there is nobody with you. And then after that, he will show you the scenarios. Most of the time, you will be able to see the clinical and management scenario on one screen, but sometimes there might be many details on the clinical scenario, saying it's just simply ask the administrator to scroll down and up for you to get all the information. And this is the reading time, which will be 5 minutes. Last year, we are lucky. We got this reading time extended to 7 minutes. I hope you got it this time, also 7 minutes. So within 5 minutes, you will read both scenario, clinical management scenario, and then they will move you to the room of the interviewer. And then you will get 10 minutes to answer the clinical scenario, 10 minutes for the management scenario and the portfolio question. So now the question will be what we need to do before the interview and how to get most of the benefit from this time before the interview. And I will hand it over to my colleague, Mohammed Abul Azain, to speak about the slides. Mohammed, over to you.
Thank you, Nizar. So hello, everyone. My name is Mohammed, and as Nizar and Yasmin mentioned, the aim of today is it's not like an ST3 course preparation. It's just to share our experiences of how we prepared to the interview last year. So it's an informal discussion about how did we prepare, so that you can have some tips and start preparing for the interviews. If you can go back to the first slide, Nizar, just I have one comment to say.
Yes.
On the pros and cons. So as you said, Nizar, there are two examiners or two interviewers on this interview. They will do all the stations, and one will do the clinical scenario and the other interviewer will be observing you, but both of them will score. Both of them gives a scoring on each scenario. So of course, this is advantage as the previous interviews, you had different interviews in each station. So just the point I wanted to mention here is that the first impression really matters. And we're all humans, even the interviewers are humans. So if you give a bad impression from the first scenario, then the scores will be on a certain level. But if you give a first good impression, then you might get more scores. So this interview, especially the online one, as Nizar mentioned, it's like a race. So we don't have a rest in between the stations. You start, you have to be at the same level till the end. That's it. If you can go down to our slide then before the interview, Nizar.
I just want to mention what you said is right, Mohammed. And at the end, the final score, they will add the boss's interviewer examiner scores together, and this will be your final score.
Yeah, so both of them score, and then I think they take, so what happens is the first interviewer give you a score, the second interviewer give you a score, and then they agree together on a combined score at the end when the interview is finished, and that's your final score on this question or this scenario. So both of them will score you. Before the interview, I think this is the most important slide in today's presentation. Before the interview, it's basically practice or preparing for the interview. And the idea of this interview is that I believe that you have to treat it as an exam. It's not an interview. It's not like a job interview that any one of us go to. It's an exam. It's like OSCE stations exam, like the MRCS Part B. So if you treat it as an exam, you will start preparing for it as an exam, meaning that you will have to practice with the other candidates, with your colleagues. You will have to plan for, like fourth point on this slide, for a study leave or annual leave before the interview. I would say it depends, of course, on each one's circumstances, but I myself, I took a week off before the interview just to concentrate on preparing for the interview. I treated it as an exam. I have a few questions here about what to practice, or questions I want to tell you about what to practice, how to practice. So what to practice is you have to practice many things. First of all, you have to practice what to say or the answers you're going to say in this interview. For example, for the clinical scenario, you have to know the answer to the clinical situation. You have to use the buzzwords, the important. You have to use the clinical information, and you'll be scored on this. And you have to practice how to say it. And this is very important in this interview. This is basically presentation skills. You have to say the correct answers fluently and confidently. And this really matters when scoring. I had the opportunity of being an interviewer for the academic foundation program. And when you do these interviews, you find that you know that the person is speaking in front of you, speaking confidently in an organized way, speaking fluently. This gives a very good impression at the start. So even if you're saying the right answers, but you're hesitant, you're not saying it in the right way, you're going back and forth, this will all downscore you. So this is very important to practice as well, the presentation skills and how you're going to say it. And then I mentioned this already, to say it in what order, which is the organization skills. You have to say it, what's the first steps you're going to make, what is the short-term plan, what is the long-term plan. So this is all important. This is all, it gives an impression, a good impression to the interviewers, and it also, they will score you in this as well. How to practice. Practice with colleagues who are going into the are going to do the interview with you. So there are many courses, ST3 courses, which is very important. So you can meet with many candidates and see what's the difference between you and them, how are they answering the questions, and then you can see if you have any defects or faults that you need to work on. So courses, you have to attend some courses, 1 or 2 courses, and you have to practice with senior colleagues like consultants. I myself practice with one of the consultants, and it makes a difference when you're practicing with a consultant rather than practice with a colleague, because it gives you a bit of the interview environment, like someone senior is interviewing you. So this is very important. Find the consultant in your hospital and ask them if they can practice with you once or twice. Another thing, I don't know, it worked with me, is practicing with yourself. I practiced at home, and the way I practiced at home is that I answered the scenarios. I recorded myself on a Zoom just with myself, and I made a video recording, and then I watched the recording of myself. And believe me, you'll find a lot of defects and mistakes you're saying in the presentation skills, in the organization. I mean, myself, when I started doing this and then I watched the video, I find myself pausing a lot between each sentence, saying between the sentence too many times. And then I started redoing this again and trying to, maybe I need to talk a bit more, talk slower, talk a bit more slowly than talking very rapidly and pausing between the sentences. So I did this, and then I practiced again, and at the second time I watched myself again and repeatedly. So this is very important, and this really helped me in the last year where I got my number. Environment, the environment that you'll be in. So online interviews is different, of course, than the face-to-face interview. So you will basically in your room, or you have to make the environment as comfortable as possible. You have to, if you have a good camera is very important. If you have a laptop with a good camera, that's fine. If not, then invest in a good quality camera. And lighting is very important as well. It's not very nice when you're interviewing someone, you can't see him very well, or the light is very dark, or you can't hear them very well. So this is all basic things. You need to get it straight right from the beginning. Good lighting, good quality camera, make sure that your microphone is working fine and there is no breaking down or cracking or anything. And also internet connection, of course, that's basic. So practice with other candidates, mock interview. Practicing, of course, with the mock interview, you have to practice with the timing of the real interview. So time yourself when you're practicing with your colleagues. Time yourself 5 minutes reading or 2.5 minutes reading, and then go straight to the clinical or the management scenario, and time yourself on 10 minutes. Next slide, Nazar. Thank you. These resources, I mean, there are many books that you can read in resources to prepare for the interview. But the two basic ones are the ATLS. Of course, you need the ATLS frame if you get any trauma stations in the clinical scenario. The CRISP textbook, which is very important as well, because most of the clinical scenario cases will be acute surgical cases. So you need to get the CRISP frame right and practice it. Of course, you don't need to read all the book in details, but you need to know what is the frame of the CRISP or the ATLS and how you're going to apply it when you're examining a patient. There is a book about medical interviews. It has very good mnemonics for the management scenario, so you can use this as well. And the other two books as well are from the for clinical, if you want to get some clinical knowledge about the interviews. But these are the books that we thought about, but there are many other sources that you can think of. Nizar, do you have any comments or If not, then you can get the second slide and you can take over.
Yeah, sorry, was muted. So I agree with you, this is very important slides, what you need to do and how you can use this time before the interview. I just want to discuss few points here. Practice with your candidates, and I prefer if you practice with other mock interview on the same way of the interview. Try to get team. At least you should be three of you practicing every day, and it will be online, so it will be very easy for everyone to practice with each other. My advice to you, first of all, let's start with the camera. If you have a HP camera, or as Muhammad said, if your laptop camera is good, that's the best. Why? Because one of the things you need to do is to keep eye contact with the interviewer, and the only way to do that is to look at the camera, to keep eye contact with the interviewer. And on the same time, you want to observe the screen in front of you, just in case if the examiner wants to stop you, and most of the time he want you to move, because he got many questions he want to ask you to score more. So you need to keep eye on the screen, and you want to keep eye on the camera to keep the eye contact. So if you got a camera, just keep it on the top of your laptop screen. So in this way, you can maintain both your contact with the camera and on the screen. This is number one. Number two, the internet, the best thing to have is the cable connected to the Wi-Fi router. If there is no way for the Wi-Fi, then to the cable, then the Wi-Fi, but nothing less than that. It's because the SIM data will not be like something you can trust. And I appreciate that maybe few of you had difficulty to arrange all this stuff at home. Maybe you just moved to a new city at the time of interview. So there is another option, which is to contact your hospital library team, and you can book one of the room and use the Wi-Fi of the hospital, and they will make sure that they will get room for you booked, and even you will be able to lock it, and you can maintain the environment you need for the interview. Now, the question will be for the camera, and this is one of the things you need to practice with your colleague and your friend. How far you want to show from your body. I think one of the important skills you need to show to the interviewer is the non-verbal communication skills by moving hand, or and the best way for that, I think you should involve the upper half of your body, and your hand should be visible to the interviewer. Regarding the practice, better to practice in the same way of interview. So one of the candidates will be examiner, and he will prepare a clinical scenario, a management scenario, and put them copy and paste on the one of the Word file, and then you will show to your colleague, and they should be stopwatch. Never practice. Maybe at the beginning you can practice without these things, but near to the time of interview, please make it with a stopwatch to make sure that you are right on the not on your answer, but on the timing of your answer. Because sometimes there are very good candidates, they lose this interview because they spend many times speaking about the scenario. So you need to practice with a stopwatch, and you need to practice like having the clinical management scenario, and then you move on, and then you have the portfolio station question ready. So you will see what is your performance, and how is your performance within this 35 minutes in one go. This is the best way. Then regarding the courses, we will not recommend any course in name, but from my experience, the best type of courses you will get benefit from is the face-to-face courses. It's not like lecture-based, but rather than a candidate, and there is a senior who will sit with you and try to make the course like the interview. I think this is the best type. Regarding the resources, as Muhammad said, you don't need to go in read these resources in details. It's just you should memorize the algorithm from the CRISP protocol and from the ATLS protocol, because this definitely we need them if your clinical scenario about trauma, or if your clinical scenario is about unwell patient. Besides the medical interview, it will help with the question regarding the interview. Okay, now we'll come to the day of interview. You need to be relaxed on that day, so have a good rest, good night before, and even in the morning. the best thing to do before the slot of your interview, check your connection. Ask one of your friends that I will give you a call, and we will try to test my Microsoft connection, camera, and take the internet. Dress smart and check your background and try to avoid any noise around you. As I said, at home, you can go to the, if you can maintain this environment at home. If not, just go and book one of the room at your hospital library, and then that will be fine. Switch your phone off or keep it silent. My advice before was to switch it off, but I think one of my colleagues told me that he was in need to contact the emergency number. As you know, they will give you a number to call just if you have any problem. So I think better to keep it silent, because the last thing you want at the time of the interview, someone to call you. And don't forget to prepare your ID and prepare pen and paper, because you need to write down, and this is a very important as we will speak about the reading time. Over to you, Muhammad, if you want to add anything.
Thank you, Nidar. No, just a comment, Nidar, about the technicality, because this actually happened with me. And you know, these online interviews, mistakes will happen. And actually, what happened with me is that during reading the clinical scenario, just in the middle of reading the clinical scenario, everything I was kicked off of the interview room, and I was kicked off and exit. And that's why actually it's very important to save the emergency number, because I started, of course, panicking and calling the emergency number. And then they actually called me as well, and they said that we're trying to get you back into the interview. So that's fine. So my advice is just don't switch off your phone, keep it handy, but just put it in airplane mode or silent and save the emergency number. So if this happens to you, you won't panic and lose your concentration. Other than that, you mentioned all the points, Nidar. So tips for the reading time. So the reading time is, you will get to read the clinical scenario and the management scenario in 5 minutes. And then you will start answering the clinical scenario. So you won't have a break. You will read the two scenarios in 5 minutes. So it's very important that he used the structured answer outlines, meaning that for the clinical scenario, my advice is to practice reading the scenarios with timings while you're preparing and practicing. And when you're reading the clinical scenario for the first time, don't read it very rapidly. Just read it, and not slowly. Read it in a good way that you can pick up the important points and write it down, like a summary of the diagnosis, differential diagnosis, the abnormal blood results, anything that will make or affect your answer to this clinical scenario. And then if you have, for example, it's 2.5 minutes for the clinical scenario. It depends on everyone, but I had 2 minutes to read the clinical scenario, and then I gave myself 30 seconds to go back quickly and have a quick run through the scenario, see if I have missed anything or if I want to add anything else. And then you will read the management scenario and then starting preparing. When you get to the management scenario, I think Nizar, correct me if I'm wrong, I think they will put the management scenario on the screen if you want to, but my advice is not to go back and read it again, because this will waste time from your 10 minutes of the interview. So the first 2.5 minutes are very important as well in the management scenario, to write all the important points that you want to do, and using the mnemonic that you have been preparing on the leadership scenarios, on when you're preparing for the management scenarios. You can ask to read the scenario again during interview. Yes, you can, but my advice is to try to get it right from the first time, because this will waste time, this will pause the interview, and it won't be in your best interest. So try to concentrate in the first 2.5 minutes and get all the points that you want to talk about. And then if you need, you can ask them again to get the management scenario on the screen. Over to you, Nizar, if you want to comment on this slide, or and go back to the next slide.
I think there is nothing more to be added here, but again, I want to stress on the same point said by Muhammad, that this is a very, very important reading time that will shape your interview performance and even your score. You got 5 minutes, and I hope they will send you another email and make it 7 minutes. But if 5 minutes This means that you need to practice from now that you read the clinical scenario and the management scenario 2.5 minutes for each. And the management scenario, most of the time, they will be like less detailed than the clinical scenario. As Muhammad said, you should have your way of reading the scenario. I know maybe one of the methods is the scanning. It's just to go through the scenario by scanning and get the main problem, get your differential diagnosis, and then if there is any abnormalities in the blood test or any X-ray or CT finding, and if there is, and remember that sometimes there might be a management component on the clinical scenario, you need also to report that one. So the best way to write down is not to copy paste the scenario on your paper, no, but as Muhammad said, you should have like outlines. And the way I use is my structure for answer, and this comes from the practice. Me and my colleague who used to practice together, we agreed on one scheme of answer or a structured way of answer. For example, we use the SPICE, for example. So then I wrote issues, and then I will go for patient safety. If you write, I think if you manage to write the issues right, all of them, then you will not need to write anything else, because you know how to speak about these issues if you got them right. So this is a very important time. You need to practice how to write, to read, and how to scan the scenario, and then try your best, as Muhammad said, to get from the first time, not to ask, show me again the scenario and the management scenario. Now we will go to the clinical scenario station. Once the 5 minutes finished, then they will get you to the room of the interviewer. And then the interviewer, most of the time, there will be two. And as mentioned in the guide, there will be other persons in the room, assessors, but you will not see them on the screen. And they will not be in any sort of contact or any way of contact with you at all. They are there just to make sure that the interview process is safe. So you will get two interviewers most likely, and one of them will start by introducing himself, the other interviewer, and then he will ask you about the clinical scenario. Did you read the clinical scenario? You said yes. He said, okay, how you are going to manage the situation. So the clinical scenarios, most of them, all the time will be acute scenarios. So you need to focus on your practice about the acute general surgery scenarios. And as I said, although it is a clinical scenario, sometimes you will find there is a point or a small management component. And the message here, if you are answering clinical scenario, speak about the management issue very briefly. And when you answering the management scenario, you find a clinical component as well. So the scenario is management scenario, but in the clinical environment. So you will see there is unwell patient there. So you need to speak about the clinical issue very briefly. This is very important. If you are answering clinical scenario, you speak about the management component very briefly and detailed discussion about the clinical and vice versa. Use the nonverbal communication, and this is good. As I said, keep your eye contact, and eye contact is to look at the camera. And you need also to observe the screen if the examiner want to stop you for any reason. And remember that always there is part of the scenario not being said yes. What I mean by that usually there is escalation, and the escalation is this the area where you shine and where you score more. So to get the initial diagnosis, differential diagnosis, and to get the issue and discuss them, this is not the end, because I think most of the candidates will be at this level. But once you reach this point, then the examiner will escalate the scenario for you. If you are speaking about, for example, any clinical condition like acute pancreatitis, and you answer, and your answer is proper, you give all the details, you listed all the issues, you answered them, then immediately the examiner will stop you, or he will immediately escalate the scenario by getting the patient into one of the complications of acute pancreatitis. And this is the area where you want to shine. That's why I see the best way to practice for the clinical scenario is to try to get the answer for the clinical scenario over 8 minutes and leave 2 minutes at the end for the escalation. The escalation will not be on the scenario. You will not see it, but the examiner will keep it at the end and he will escalate the scenario, and then you need 2 minutes because this is where you will score more than your other colleague. So that's why what I mean by manage your time appropriately. Try your best to answer the clinical scenario in 8 minutes and leave 2 minutes at the end for the escalation. CRISP and ATLS algorithm, you need to speak about the CRISP if the scenario is about unwell patient, and you need to speak about the ATLS algorithm if the scenario about trauma patient. But how deep you want to go into this algorithm, this is the time of practice. You need to practice how to say the algorithm of CRISP protocol without being very detailed, and on the other hand, not to be also missing a very important point from the CRISP and algorithm. So whatever the structure you are using to answer the clinical scenario, just make sure that you will cover all these 4 domains. You should recognize all the clinical issue, because this is the way they will score you. That is, if the candidate mention all the issues, then this is score. And number 2, the priority. The structure you are using, you should mention clearly what is the, because you got many issues in front of you. What is your priority here? And this is a very important. Planning and use of investigations and resources. And most of the time, this is the area of prompting. And as you know, any process of prompting from the examiner, from the interviewer will down score you. So try to think and be logical in what type of ultrasound or imaging you are going to request and why. Because if you said, I will go for CT and the appropriate imaging at that time will be the ultrasound, then the examiner might say, do you think the CT is appropriate at this level? Then this is prompting. He wants to get you right to the right type of image. So think about the most appropriate source of what type of imaging or investigations, and use the resources appropriately, because this is the point where the people start get prompted from the examiner. The other bit is the communication strategy also. You said patient has a chest infection, and then he will start prompting you to ask for the respiratory physician, or to do a chest X-ray, or to do ABGs. So remember all the time that the first domain, the second domain, most of the candidate will get them right. The third one and the fourth one, this is the area where the prompting start, and that will down score the candidate. Over to you, Mohammed, if you want to add anything.
Sorry, just unmuting myself. So I think you've mentioned everything, Nazar. I think, yeah, as I said before, the organization of your answer is very important here. So if you're starting with the recognizing the issues, as Nazar said, you have to give a differential diagnosis. Think about if you're like getting a referral and you're talking to someone. You're thinking about, oh, this patient might have perforation, this patient might have volvulus, this patient. So you have to give, I'm thinking about my differential diagnosis for this patient will be 1, 2, 3. And then you can also start with having some initial management before even going and seeing the patient, like asking, make the patient in a safe place, take him to resus if he needs to, or ask the referring team to do some investigations. This gives a good start as well before just going and seeing the patient. And I think it's very important to mention COVID-19 during these times as well. So I'd mentioned that I need to make sure that myself and my team are wearing the appropriate PPEs when we're assessing the patient. So this is important. And also you need to know for the surgical issues, or if you need to know surgery, of course, you have to mention the morbidity and mortality score, the NELA scoring, the PPOSM if you need to. Something else is the communication and strategy is that you need to communicate with all the different specialties according to the patient case. So it's very important as well from the beginning when you're reading the scenario, just to point out maybe the comorbidity of this patient and what teams you'll need to contact regarding this patient. If he's in clopidogrel, you need to contact hematology. If you have cardiac issues, you need to contact cardiology team. So focus on this as well, as this is scored on the communication and strategy. I think that's all for the clinical scenario, Nizar. If you can, yeah, fine. So management scenario, it's a problem-based scenario or leadership in the clinical environment. And as I said before, it's preferable if you don't ask to go back and to read the scenario again, because this will waste your time. But if you need to, you can ask to put the scenario on the screen again. If there is a clinical component, as Nizar mentioned, you need to briefly comment on it, just in few points, and then go ahead and start commenting on the management issues in this scenario. Again, as in a clinical scenario, you need to organize or identify all the issues in the scenario. And then you need to organize your team. Say, I'll organize my team. This is my resources, 1 SHO, 2 F1s. And you have to prioritize as well your answer, saying patient safety is my priority, or depending on the clinical issues that will be in the scenario. It's a good way also to arrange your answer in the short term and long term. So in the short term, you need to deal with what's happening today. And then you can comment at the end that my long-term plan for this issue is to try to avoid it happening again. For example, if it's a medical error, you can say we have to arrange some teaching. If it's a clinical issue, then you can say we can arrange an audit. So it looks good when you divide it in a short-term and long-term plan. And of course, I know that this will be mentioned in the courses that you will attend. You have to use the buzzwords in this scenario and then expand on each one of them. For example, if there is an error, you have to mention that you will put in a datex. If there is a complication after surgery, then you have to mention the duty of candor. You have to say these words, and then you can expand on them and say, I'll go and apologize to the patient and expand on these points. One of the comments that I got on my scenario is that I did not ask the consultant to come in from the start of the scenario. So it's very important if you're having a difficult scenario, like many things happening, it's a difficult on call or something like that, is to update the consultant. And my advice is to say, I'll ask the consultant to come in from the beginning. So this was one of my comments. So I think it's very important to mention that you will involve the consultant and say it bluntly. I'll ask the consultant to come in and help me in managing these situations. Yeah, so this slide again, it says how you're going to be scored on recognition of the management issues, the prioritization and time scale, the strategy and communication, what you're going to do. And this is, I think, where you can divide it into short term and long term. And then outcomes and challenges. If you say the right things, then the interviewers might challenge you and ask you a different question and build on these things, which is a good sign. It means that you have answered all of the previous questions or in the right way. I think that's it from my side, Nizar. Over to you if you want to comment on these slides.
Yeah, I think, one of the important things we need to make ourselves familiar with is escalation or pathways of escalations. If the clinical of the management scenario is about, for example, training issues, then how to escalate it. If it is about Muhammad said, maybe a mistake or incident, how you can escalate, because one of the things they want to test here, that if you are familiar with the NHS environment and how to correct these mistakes, as well as in the clinical scenario, for example, there are a few things you should mention them together. For example, if the final diagnosis was something needs surgery, then the next step should be, I will speak to the patient, explain to him the CT finding, and because sometimes the patient will say, I don't want surgery, so it will stop everything. So that's why this is something usually will come together. Speak to the patient, update him with the CT, do the risk assessment score, as Muhammad said, NELA or BOSAM score, escalate it to your consultant, discuss with the family, anesthetist, ITU, and blood bank if you need any blood. So these are few things you should memorize them, and they will be very ready in your mind to mention them when it came to the escalation. So I think one of the important things there to be familiar with the escalation pathways. Okay, and the last station will be the portfolio stations. And the portfolio station is about generic questions. And when we say generic questions, we mean they will not ask you about your portfolio or your portfolio like personally. They will ask you general question. For example, they might ask you just to give them idea about your progress and your career up to the point, starting from the time you graduate from the university and up to the time of the interview. It's very important to be aware that they don't have any hard copy of your portfolio. So they will not ask you about any specific paper or audit you mentioned on your assessment form in the application. But they will ask you, or maybe they will ask you about a specific audit. And they will not mention them, but they will ask you about something you are proud of, for example. So they want to see, number one, if you have any papers or audits or anything, but they will also assess why you consider this paper or this audit specifically is very important and you are proud of. And this here will reflect to them if you understand the process for audit, how you will conduct the audit and all this stuff. So here, basically, the assessment will be, as Muhammad said, will be how to communicate your answer. So my advice to you regarding the portfolio stations, use the interview book and try to go through the generic questions there and see how you will answer the question. But the most important thing is that this is 10 minutes. And most of the time, the questions will be between 3 and 4. So you need to practice and put the stopwatch, and you can record yourself as Muhammad did. To record yourself and make sure that you are answering the question properly. You cover all the points within the time of 2.5 minutes. Just in case if there are 4 questions, so you will get time for each question. So one of the difficult questions which they used to ask for any interview, not only for ST3, even for the non-medical job, is tell us about yourself. So this is a very broad question. You might need like hours to speak about yourself. And on the same time, it's one of the difficult questions because we are not familiar to answer this question. So here the practice is to give answer that will explain all the different aspects of your performance within 2.5 minutes. So the best thing is to practice with the stopwatch in front of you and record your answer, and you manage and you change this one, you add this one until you get the right answer. And the question will be, what structure I should use to answer these generic questions? For example, tell us about yourself. The best way, maybe there are other ways, but the best way may be to answer it in the same way of the title of the applications. This may be one way you can use it as a structure to answer this question. For example, if I want to speak about an audit, the best way and the structure that I will use to answer this question is to go through the different steps of audit. The audit will start at you will observe something of the care at your department or your hospital, and you want to assess if that bit of care is up to the quality and the standard or not. So you will say, I observe this issue, and the number 2 you will discuss with your senior, which will be the supervisor or trainer of you. I'll discuss with the head of the department, and then I said, and here we will use the different terms as Muhammad the buzzword. I thought this is a good opportunity to mentor the junior about how to do audit, or this is a good opportunity to lead an audit. So you want the examiner to get the word, which is the leadership and the teaching, and that will be scored for you. And then you will speak about the audit cycle. So always have a structure for the portfolio station question. Answer them with a structure. Say, if they ask me about my CV, I will speak on the same structure of the application. If they ask me, for example, about audit, and I will speak on the same steps of the audit cycle. And on this way, you will make a structure, assess yourself, you will be able to answer them within 2.5 minutes or less than that, and the less better. Prepare yourself to respond to portfolio gaps, because sometimes there will be an added questions. So if they ask about your audits, or sorry, about your CV, for example, and then you didn't mention in your operative skills. For example, you did appendectomy. He might ask you about this issue. So definitely, any one of us had a gap in his CV. Your CV will not be appropriate and 100% perfect. So there is gap and there is something missing in your career. So have a structure of answer for the question speaking about the gaps or something you don't know. That and the best thing to do is to like have a boss and think about what is your plan for this gap, how you will manage and you will correct it. For example, if they ask about specific operation, generic operation that the interviewer expects you to have it on your CV, then you stop and say, my role now, for example, is not allowing me to attend more sessions in theater. So I have spoken to my clinical supervisor, I have spoken to my educational supervisor, and I explained the situations. And now this is the plan. So this is the best way to speak about your gaps in the portfolio, that you got plan for everything. And this plan will get you to complete this gap and correct it. So it's not a problem at all to have this question in the interview, and don't take it as something will down score you. No, if you mention to them that you aware of this gap and you got plan to manage and to correct this gap, that's all. I think this is my advice for you in the portfolio station. Ahmed?
Yes, thank you, Nizar. I think this is one of the most challenging stations, Nizar. I think last year was the first time to be introduced as an online interview. But I also think that this is one of the scenarios that you can score very high on it, because you know all the questions already. I mean, you're not going to invent any new questions. The questions are all available. For example, the clinical scenarios, you don't know what clinical scenario you're going to face, but the portfolio questions are the same. In any book or any course, they will tell you, they'll ask you about your audit, your CV, your logbook. So you will be asked one of these questions. So you have to prepare for these questions from now. And my experience, or what I did, which is advise you to do as well, is that I sat down, I wrote these questions, and then I wrote the answers on a paper, how I'm going to answer this question. And then reading it again, correcting it, rephrasing the answer, and then started rehearsing it many times. And then I recorded myself as well as on video, and repeatedly making it better every time. So it's this scenario, this station, you don't have time to think. And with the stress of the interview, you're not going to you're not going to talk comfortably about yourself in the interview because of the stress of the situation. So you have to prepare your answers previously. And so on the interview, on the day, you don't need to think about it. Once they ask the question, you will just answer from what you have rehearsed from your preparation. And even if you get a different question, you will answer from the same preparation that you have done. You can just change the paragraphs, or you will work out the question, or you will direct the question to what you have memorized or what you have rehearsed and prepared. Just for example, when I practiced with one of the consultants in my previous trust, they asked me, tell me about your logbook. And I didn't know what to say. My logbook is my operation numbers in my logbook. I mean, I didn't know what to say. But after practicing, after I sat down and I wrote down how I'm going to talk about my logbook, then my answer from I didn't know what to say, it was, for example, over the last years of training, I have added a lot to my clinical and surgical experience through surgical courses, attending theater sessions. I've attended 5 courses in the last few years. I have used validated tools of assessment like WBAs, PPAs on my ICP portfolio. And then I started talking about I'm confident in managing the acute surgical take, in managing outpatient clinics. This is all about your logbook, but you will not think of these things on the spot during the interview. You have to prepare for them. And then I started talking about my numbers. I've done, for example, 45 appendix, 10 laparoscopic cholecystectomies. I've done 20 DOPS or PPAs, validated by multiple consultants. So if you prepare for this question, then you will not think about it during the interview. But if you leave it to the spot or during the day, you will pause. You won't know what to say. So I think the best way, or this is how it worked with me, is that I wrote down the answers of all these questions and I've started rehearsing them. For example, for the audit question, many of you will be asked, tell me about an audit you have done or something you're proud of in your portfolio. You have to talk about the audit in a certain way, the audit cycle, as Nizar mentioned, and this will be mentioned in all the courses as well. But for example, think about something that you're proud of in your portfolio, and then you need to write it down, how you're going to talk about it, and rehearse this, what you have written, and practice your presentation skills on the video and how you're going to say it. Because this all makes a big difference on the day of the interview, because with the stress, with the time restrictions, you will forget a lot of things. But if you have rehearsed well on a well-written answer, then this is the only way that you will say it in a good way and will make a good impression during this portfolio session. I think there's nothing more to add on this station from my side, Nizar. So
yeah,
if anyone
think,
has any question, or go ahead.
Yeah, I just want to add that if you want to speak about something you are proud of, just make sure that's really a good one. For example, audits, you should reach up to the presentation, either regional or international, because this will score more. I think that's all what we have for you today, and we will be more than happy to answer any question. Back to you, Yasmin. I will stop sharing.
Thank you both very much for that. It was very informative, especially the portfolio station. I think, as you said, there's lots of questions around it, and I think it just needs a bit more clarification for people to be aware of what they're expecting. I'm sure everyone will learn a lot from your experiences. So in the question box, we have 3 questions already. If you have any more, put them on there or raise your hand. The ones we had already is about a mock event or practice sessions. So we will be arranging these for 6 weeks before the interview. So maybe mid-February when we will be starting them, and they will be separately advertised. The other question was about
just to comment, Yasmin, I think both me and Nizar were in these practice sessions last year, and many thanks to you guys. I think it's very important, and it will be once a week, so it's very important to go every week and attend, and then you'll see if you're progressing, how are the other candidates progressing, and so it's very important to attend these sessions as well. They were very helpful.
Yeah, they were very helpful, very useful. Yeah.
All right, so the second question is whether in the portfolio station you will be asked questions like, where do you see yourself in 10 years? Things like that. I don't know if you have experienced these kind of questions or if you have heard about them.
I'll go first, Nizar. I think I didn't get this question, but I think it might come. I mean, any questions on the portfolio station you might be asked these questions. So the best thing is to prepare for it. Write down a brief answer for this question, and if it comes, then you'll have a prepared answer for it.
And I think if for this question specifically, you need to be aware of exactly what 10 years means. So you are familiar with the training, how many years you will spend, and where you will be after consultant or fellowship or something. So this type of answer, just have a pause and think about it, where it will be in 10 years, and then you crack on with your answer.
I'll add one point. I mean, I think it's probably similar to the face-to-face ones. And one of the questions that was mentioned before is maybe not where do you see yourself in 10 years, but if you get a training number, how would that change you? Or they give you a situation where you've got the number and your partner has a consultant job somewhere else. How do you solve that problem? So there's different aspects to it rather than just where do you see yourself? It's different variations, I guess, of the same question. Because if you get a number in 10 years, you should be a consultant.
Yeah. As you said, it might be asked in a different way. So think of the question that you might get asked and prepare an answer for them.
Yeah. The other one is timeline between submission of evidence and shortlisting. I think, Nizar, you mentioned it briefly that it was a bit tight last year.
Yeah, it's very tight. I hope this year is corrected. But anyway, you expect your interview to be at the beginning of April, as mentioned in the guide. So I'm not sure when you will get the you will know that you've been shortlisted for interview.
Sorry, the question is, so if you can have the PowerPoint presentation, this was all recorded and it will all be available. So the PowerPoint presentation will be available as well. And another one is if they go through WBAs in detail. Probably if they ask you about the different levels, what kind of WBAs you've got, how many CBDs, etc. Because obviously they don't have access, don't they, to the to your portfolio.
I think nobody knows exactly what the question will be asked and what the question they will not ask. But if we say generic question, then the aim from the question is to assess your knowledge about this topic. And if that, you will give like structured answers. So unlikely the question will be just for the sake of number, because already they put that on your verification score. So the question will be, I think, most likely about to test your knowledge about the what's your role in your hospital to improve the quality of the care and all this stuff, and to assess if you are progressing appropriately on your career or not. I think that's what we think, Mohammed.
I think the same. I don't think they will go through details in WBAs, but you need to know your numbers. I think that you need just to mention, I've done this, the numbers, but they won't. Unlikely they will go through the details.
You need to know your, I absolutely agree, you need to know your numbers because they might ask you about your experience rather than specific WBAs. Yeah. Right. Same about the presentation. So we've mentioned that already. The practice sessions, they're all online. They'll probably be on like Microsoft Teams or Zoom. We will advertise them. So if you keep an eye on our the YouTube channel, probably going to put that underneath the video, so you can just get access to that. And you can just sign up for that. So it's the same about advertisement, about the mock practice, and also if once a week is good, it's not perfect. I would definitely recommend you do more practice. So if you, between all of you, feel like you know a few people around you that are going to go through the same process, practice in hospital, practice private sessions whenever you're free. So you don't have to wait for these sessions as well. So someone's asking, for the final selection, do we know the weightage for interview and self-assessment scores?
Yes, they will. They send emails with the interview score and the weighted score for your the verified score, and then they will say this is your final score, and you will find it on the Oriel account beside your name and account. There you will find your final score there, and even you can, if you discuss with your friend, everyone will get his number, a score, I mean, and then you will see how far you will be from to be appointed with one train number.
I think this is after the interview, but I think this
no,
is
definitely after the interview. Yeah, definitely.
I think the question is asking before, so I don't think that we know what's the weight of the interview. We don't know that. No,
that should be after the interview.
I mean, as far as I understand, the self-assessment gets you long listed. The evidence gets you shortlisted. And I'm not 100% sure, but I have heard that between self-assessment and portfolio, that's around 60% of the score.
Yeah.
So it's
last year they sent email that the clinical scenario score will contribute to 20%, and the management scenario will contribute to 20%, and the portfolio, which is amazing, was 28% of the final score. And the rest was
This is actually, Nazara said, I mean, the portfolio station is just it's very important to try to get as maximum scores because the questions are already known. So as Yasmin said, it's 28% plus the rest on the self-assessment.
Yeah, plus the self-assessment.
So someone is asking about how to get in contact with us. So we have an email. I'll put it in the chat box as well. So if you have any questions or you want to get in touch with the organization, that's the easiest way. And someone's asking if I panicked while answering and want to start all over again, would that be okay?
It would be okay. No one will say you cannot do that, but it won't be good for your scoring. And I think the way to avoid that is just to practice as much as you can to avoid panicking on the day of the interview. But if it happens, it happens. But I think this will not give a good impression to the interviewers.
Okay, this is why practice is important, because you
Exactly.
panicking.
Yeah.
All right, another question. What's the self-assessment cutoff for the interviews last year, and what was the minimal score for?
I don't think this was sent off, so I'm not sure.
No.
It wasn't.
No, it's not published. Nobody knows. Yeah, but they didn't mention that one.
And also, it depends on how many available interview slots they have, and it changes every year.
Yeah.
So I don't think it's going to be the same this year either way.
That's right. Yeah.
Okay. Is it essential to have 40 WBAs per year, like the requirements for CST?
I don't think so.
No. This time already done by the verification score, so we will not ask you about any number, and that will not like be something you need to make photos and all at all.
Great. Another question about the scores. We've already answered that. I think that's it. Rashad, I think you had your hands up at some point. You want to unmute yourself?
Someone is asking about the YouTube channel as well, Yasmin. What's your YouTube channel?
So it's ESSDB. It's the Egyptian Surgical Society in Great Britain.
Yeah.
I'll put a link on, here we go, we've got the link on there. And there's another video from last year, a bit more detailed about how to answer the clinical and management scenarios. You can watch that as well. I think I need to unmute you, Rashad, see if... Here you go. Do you still have a question, or is it all answered?
I think he says thanks, Yasmin. So most probably you answered all the questions.
Answered. Great. Any more questions, anyone? Great. Thank you very much for your time, for sharing your experiences. It was really, really helpful. Yeah, if you have any questions, if you want to get in touch, you know how to get a hold of us, and we'll be advertising shortly for our prep sessions. Thank you. Have a good night and good weekend.
Thank you so much, Yasmin, and thank you, everyone. I wish you all the best in the interview. Thank you, Mohammed.
Thank you, Nazar. Thank you, Yasmin.
It's hard work to get long listed, so congratulations on that.
Thank you. Thank you so much.
Good luck. Okay.